name is Molly Mental, and welcome to BScN 15, the news station you hate to love, but you have to watch us anyways. Our top story this evening is how to effectively assess pain in the cognitively impaired patients. Now we go live to Linda Longterm to discuss more on this topic.
Oh, hi. This is Linda Longterm reporting live from the Forever Young Clinic. Follow me. Today, I'm going to give you a first-hand view on what it's like for a nurse to assess those that are cognitively impaired.
Hello? Is this the nurse's office?
Daisy, that's the men's washroom.
Well, that sure isn't the nurse's office.
Now I'd like you all to meet Petunia Pretty Painful.
It's pretty-painful.
Anyways, she's a nurse, a real nurse, at the Forever Young Clinic. Her job is scrutinizing, and an important part of managing the lives of our elderly. Hello, Petunia.
Oh, hi.
Petunia, would you care to define cognitive impairment and the effects that it has on pain assessment?
Well, cognitive impairment is defined as an acquired loss of memory that's substantial enough to interfere with everyday functioning, and it's usually associated with behavioral and psychological changes. Pain and cognitive impairment are prevalent among older people. Between 50 to 86% of older adults experience chronic pain daily. It complicates a pain assessment because it impairs memory, judgment, and verbal communication skills. It's associated with CNS changes that alter pain tolerance, but not their pain threshold.
Hello?
Daisy, come on in.
Hello?
Do you want to come have a seat?
Sure.
How are you doing today?
Good.
That's good.
Oh,
This is our friend Linda. She's just going to be filming for us a little bit today.
Hi, Daisy.
Okay, Daisy, so our friend Linda's just here today to observe a pain assessment. Is that okay with you?
of course.
Daisy, are you in any pain today?
I'm always in pain.
If you had to rate your pain between 1 and 10, 1 being very mild pain and 10 being the worst pain you've ever felt, where would that fall today?
I don't have any pain.
Now let's watch Petunia try a different approach.
Daisy, are you in any pain today?
No.
None at all? Mm-mm. You know what, I have to go and grab something from the other room. Would you like to take a walk with me?
Sure.
Oh, perfect. Need some help up? Oh, good job, there you go.
Oh,
How you doing, Daisy?
good.
You doing good?
Yeah.
It looks to me like you're rubbing your hip a little bit. Are you in any pain?
Yes.
Yeah, your face looks like you're grimacing.
Yeah.
Yeah. If you had to rate your pain between 1 and 10, Daisy, with 1 being not too bad and 10 being the worst you've ever felt, what would you say it is?
I think a 6.
A 6? Should we go sit back down, Daisy?
Yeah.
Yeah, okay, let's go.
Self-reported pain is the usual criteria standard of pain assessment. Healthcare professionals recognize that this alone is insufficient for people with cognitive impairment, and observational pain strategies are needed. Observational signs of pain include bracing, guarding, rigidity, shifting, stopping, grimacing, and rubbing. Like Petunia said, cognitively impaired elderly people also recall shorter pain duration.
There are multiple barriers that may affect a nurse's ability to conduct a pain assessment in the cognitively impaired, specifically in the older generations. Older people may not voluntarily report their pain, due to belonging to a generation generally possessed of a more stoic attitude than younger people, and many are reluctant to bother busy nursing staff. They may also underreport pain because they tend to use different language to describe how they feel, considering it to be an ache or soreness, or some other description which does not actually include the word pain.
Cognitive impairment was associated with more rubbing, which is considered a stereotypical movement in persons with cognitive impairment. The findings of studies support the utility of facial grimacing as a behavioral indicator of pain in cognitively intact and impaired patients. Healthcare practitioners should use these techniques to identify and track pain in vulnerable older adults with cognitive impairment, as facial grimacing is an indicator of pain.
As an implication for nursing practice, it is clear that solely using a traditional pain scale is not as effective as the combination method of using self-report as well as behavioral observations of the cognitively impaired client.
I'm Linda Longterm, and this concludes our segment for today. Back to you, Molly.
My name is Molly Mental, and thanks for watching BScN 15. Up next, the do's and don'ts of the pediatric assignment.